I'd like to welcome up Dr. Nahid Bhadelia, class of 1999, Fletcher 2004, and medical school 2005. Dr. Bhadelia, you are a most courageous triple jumbo, an alumna of the undergraduate school, the Fletcher School, and the medical school. As assistant professor of medicine at Boston University School of Medicine, an infectious disease specialist at Boston Medical Center, and the director of infection control and medical response at National Emerging Infectious Disease Laboratory at Boston University, you would seem to have enough to do. But in August 2014, you joined the fight against Ebola, spending 12 days treating patients and witnessing patients, colleagues, and healthcare workers succumb to the disease. You returned to an Ebola epicenter in West Africa as a clinical lead with Partners in Health. You then spent over a month in Sierra Leone training survivors to be ancillary healthcare workers in a treatment unit and returning again for quality assurance checks. Yet you considered the local people the real heroes, as you recently told a group of Tufts faculty and students. She said, "It was witnessing the sacrifices of the healthcare workers and the nurses, mainly women, who risked personal safety, financial ruin, familial strife, and physical exhaustion to help battle the disease. The stories you hear about what the healthcare workers have gone through are just unbelievable. So many went through the trauma of seeing friends die in their units. For them to be there, and it's an immense part of personal bravery." While in the field, you created a crowdsourced mobile payment service, Splashcase, raising over $41,000 for local nurses' wages. Some used the money to pay rent, others to move their families to cleaner or safer surroundings. An ambulance driver used his funds to buy a motorcycle to earn money as a taxi driver. Another took more nursing courses to improve her training and qualifications. And about this experience, you said, "They are just flabbergasted. They're like, what do you mean? People are giving us money out of nowhere? We're suffering. We're at the end of the line. What kind of people are these who would send money to strangers? I gain more out of this than I think anybody else does because it's such an amazing feeling to put money exactly where it's needed." Dr. Bhadelia, your extraordinary commitment to humanity is an inspiration for the entire Tufts community, and the Tufts University Alumni Association is proud to bestow upon you the 2016 Active Citizenship and Public Service Award. Congratulations.
Probably wasn't fair to put me after all these amazing winners, so I'll try to keep it brief. I do want to start by just congratulating all my fellow honorees. I'm just so honored to be in your company. And this is an immense honor. I want to thank the award committee, the Alumni Association, President Monaco, but last but not least, my nominators, and friends who have supported me through my journey, especially over the last couple of years. And in particular, I want to thank my family for being my foundation, for being my inspiration, and for taking me in during my multiple Ebola quarantine stints, something only family would do. You heard about the beginning of my journey in August 2014. I somehow, intellectually knowing what I was getting into, still found myself amid what probably Mark has described in this video as well, a place that saw hundreds of patients with only a few people to help. So in the last 20 months, I've traveled back and forth from West Africa 5 times, worked in a few different Ebola treatment centers, seen incredible inequalities in the way that people live and die. I've lost almost half of my patients, just for lack of simple amenities and interventions. I've seen people die and be buried without names. I've seen the sickest miraculously recover and become champions for others around them. I've had the honor to stand shoulder to shoulder with the national healthcare workers as they buried their own, and they fought for simple things like a safe working environment and for getting paid for the work that they're doing. I've had hundreds of strangers open their hearts and their wallets to help me create this fund drive to help honor these healthcare workers. I've been quarantined by my city, stigmatized by a few, but supported by most of my communities, and Tufts community, all of my Tufts communities, I should say, are right up there. I've been poisoned by a millipede. I've had a close encounter with a fruit bat, and I've gained a new appreciation for bucket showers. I've seen the worst of human behavior that's been compounded by crisis, and I've seen the best. I have seen how much those with very little are capable of giving, putting the rest of us to shame. I've seen my friends get sick from Ebola. I've seen some of them die from this disease. I've feared for my own life a few times. And I've dealt with survivor's guilt. And after all this, what I've really come to realize is that I'm one incredibly lucky human being. How much more have I gained than what I've given? So you'll understand why I feel strongly that my contributions are actually a drop in the bucket. And this is not false humility. C.S. Lewis says, humility is not thinking less of yourself, it's thinking of yourself less. And isn't that the spirit of this award? The Ebola epidemic has claimed over 11,000 lives and has disproportionately affected healthcare workers, devastating already strapped healthcare systems, leaving behind a legacy of potentially lasting adverse effect on the health of communities in West Africa. It's also left almost 17,000 survivors with chronic debilitating symptoms and immense amount of stigma. I spent 9 years of my life at Tufts. So if anybody has had any chance to mold me aside from my parents, it's actually Tufts. For those of you who know me, you know I'm a rebel rouser. Blame Tufts. In my 9 years at Tufts, the value that has so firmly been ingrained in me is the ability to see the larger world as part of my community, to see the interdependence. I was lucky enough to have teachers such as Professor Dale Bryan and Paul Joseph in the Peace and Justice Studies program that helped reaffirm how much change we can make as individuals when we move beyond cynicism and work towards a world as it should be and not as it is right now in the status quo. Emerging infections and epidemics, they force us to see the larger world as our community. I recently read an article by Kevin Burdosh, he talks about One Health, and he says, microbes are the critics of our modernity. And I think this is immensely insightful. Health inequalities not only devastate the communities where they exist, but they propagate epidemics. And now, epidemics move not at the rate of human migration, but at the speed of human travel and trade. They take advantage of our blind spots, our inability to see when new cases arise. And the reason why do they do that is because those folks who are actually having the early clusters are not able to seek care. At no other time has our community been smaller. At no other time has being an active citizen been more aligned with personal returns. We live in a world that constantly pushes us to sanitize, flatten, glamorize, and present ourselves in 140 characters. At no time has service been more important for our own survival, and Tufts has been teaching that for generations, and I certainly received that both from my parents and from this university. My work during this epidemic has re-inspired me as a physician and as a person to be a better human being. I want to thank you for this honor today, and join me in accepting this award on behalf of hundreds of healthcare workers who jumped into this fire, some paying with their own lives. And I want to dedicate this to all the patients that we couldn't save. Thank you.